But you can translate this into what you're doing, right? Okay. So how do we decrease the chances of Albany ENT ever being named in a suit? Okay. Early identification of unexpected events. If something happens, let someone know. Okay? Let someone know that after an allergy shot, the patient started wheezing. Okay? Adverse event. Thorough documentation. Okay? From the front desk to the discharge desk and everything in between. Be knowledgeable, policies and procedures and rules and regulations and adverse effects. Okay, be knowledgeable of that. You guys are here for a reason. Be knowledgeable of the practice. Okay, equipment use. 2 terms: design flaw. Okay, the manufacturers designed it improperly. So, let's say it's an IV pump, which I know you guys don't use. You don't use IV pumps here, do you? Okay, but let's say in a hospital, the IV pump, the first click used to be 50 cc's an hour. Now the first click is 100 cc's an hour. And the nurses just move it 1 click. What's going to happen? Medication error. Or human fault. Okay? Really bad example of this, which is very easy to talk about. Down in Pittsburgh a few years ago, a hospital got a new model colonoscope. Okay? It had 3 lumens in it, 3 holes that they could introduce things or take samples out, specimens out. It had 3. The old scope had 2. Okay? The technicians cleaning the scopes after each procedure didn't know this. They weren't in service. So for 200 patients, the 3rd hole, the 3rd lumen was never cleaned. Okay? So 200 patients had to be called back and be screened for hepatitis C, HIV, and any other bloodborne pathogen that they were concerned about. 200 patients were exposed to each other. Okay? Not in a good way either. Okay, so be careful with equipment use. All right. Benefits of quality documentation: if it is a good chart, nice and clean, and even if there was a bad outcome, okay, bad outcomes occur even though malpractice didn't happen. Okay, if it's a nice clean chart, the plaintiff's attorney's not going to take the case. They're not going to spend their time and effort and their own money investigating a case if they don't think they're going to get something out of it. Okay. The Department of Health, the State Education Department, they might not proceed with anything if the documentation is there. And it's more reliable than your own recollection. How long do you think a typical case might take? As I've said, 8, 10, 12 years maybe. Okay? It's not, 90 days. So is your recollection 3 years later, 4 years later going to be better or worse with time? It's going to be worse. So your documentation, which you may review with our attorney, okay, it may jog your memory a little bit, okay? Demonstrates good communication between the whole team, demonstrates quality care. It might result in an early resolution to the case. The insurance companies call that making the case go away, okay? It might result in that. So we need to make sure we properly identify the patient. Get involved in appropriate quality improvement, which Deb and Julie do, okay? And that you go to ongoing education programs like today based on quality improvement. They asked me to come in and talk about documentation, okay? Because they're seeing some documentation issues. That's why I'm here. That's why you're here, okay? Develop good rapport. Public relations with your patients and your families. If, as I said earlier, if they like you, they are less apt to go after you, okay? Unlike my friend here, okay? So, while you look at that and chuckle, I'll ask you once again, if you have a second, please fill out that evaluation, just leave it on the table. And do you have any questions or thoughts? I'm gonna be here, for a couple more hours. Do you have any thoughts or questions now? If something comes to you in the next 20, 30, 40 minutes, come back and see me.
Yeah. I have a question. Like, if I get a call from my secretary and she says, hey, I got this patient on the phone, wants to know when he's due for his next shots. I look it up and I tell her and she says, okay, and then she goes back home. Should I be documenting something?
Yep.
Just a chart note stating?
Just a little chart note. How long is it going to take you to do that?
No, long. I just wanted to.
30, 40 seconds? Sure. You need to document everything that's being done for the patient. So would that include a phone call, question, and answer? Sure. All right. Anything else? Questions, thoughts? Thank you very much. You didn't throw anything at me. Take that as a good sign.